Yeah, that's a perfect segue, Dr. Brown. And you may have just covered this a little bit, but I want to give the other guys an opportunity as well, is the aftercare and how the microscope plays a part in that. What else would you guys say is part of the aftercare process with the microscope? Dr. McCawley?
Well, we take a sample at the beginning of therapy, and then 9 months later to see that the bacteria are gone. So we say that if they're gone, you're actually cured of the infection. Now, you can get it back. So part of the aftercare is terrific home care, which involves tongue cleaning, flossing, brushing, and irrigating with antiseptics. So they then know that they're responsible. Now, we can get rid of the bacteria, but you got to keep it out. But we will test you. And if you come back in 6 months or 9 months with a few there, we then can focus on what's going on, home care, like that. So the aftercare is critical to see that the bacteria are gone. So that's a dramatic demonstration that they're actually cured of the infection.
Well, our aftercare, we take slides periodically. We don't take them all the time. We take them periodically if there's any suspicion of any kind of problem. But we don't take them every time. We certainly take them at the beginning and periodically. But what I tell the patient is, look, this is a 50-50 treatment. We're going to treat, I'm going to stop the infection. Sometimes I'll use the word, I'm going to stop the infection. I'm going to cure the disease. That's my half. Your half is to stay cured. Your half is to do what you need to do at home. If you need to do what you do, if you need to do your part, you do your part, and we can get a great result. But if you don't, this disease is going back, and we're not going to have the kind of result we need. So I'll do my half. If you do your half, things are going to work out great.